Bismillah Rahman Rahim. Today is the fifth episode of our discussion on metabolic health. Topic for today's discussion is the gut-liver axis, microbiome, metabolism, and inflammation. Regarding the gut-liver axis, microbiome, metabolism, and inflammation, uh, let me ask you a question. Did you know that your gut bacteria could be fueling MASLD, insulin resistance, and systemic inflammation? The gut-liver axis plays a crucial role in metabolic health. And today, we shall uncover how dysbiosis contributes to chronic disease and explore emerging microbiome targeted therapies. So I'll start with the first case, the gut-liver axis, why it matters. A case scenario, a 45-year-old male with obesity, pre-diabetes, and mild MASLD reports chronic bloating and intermittent diarrhea. He is obese with pre-diabetes and mild MASLD. He reports chronic bloating and intermittent diarrhea. His stool test shows increased firmicutes to bacteroides ratio. What is the connection? Key learning points from this case history are: the gut and liver communicate via the portal vein. We know that. Transporting nutrients, microbial metabolites, and endotoxins. Dysbiosis, that is the gut microbiome imbalance, can trigger MASLD, insulin resistance, and systemic inflammation. Increased gut permeability, that is the leaky gut, leads to endotoxemia and hepatic inflammation. So the expert insight on this case history will be: think beyond the liver. A dysbiotic gut can drive metabolic disease even before liver damage occurs. So this is the cage point. Let's discuss the case history number 2. The title for this case history is How Dysbiosis Drives MASLD, Insulin Resistance, and Inflammation. A 38-year-old woman with metabolic syndrome and MASLD undergoes stool analysis. She has high levels of lipopolysaccharide LPS and low short-chain fatty acids. So the lipopolysaccharides levels are high, stool levels for lipopolysaccharides is high, and the stool levels of short-chain fatty acids are low. What does this indicate? It tells the key pathophysiologic mechanisms. Lipopolysaccharides endotoxemia, because these levels were high. Increased gut permeability allows lipopolysaccharides to enter the bloodstream, triggering systemic inflammation and hepatic steatosis. So this is the way how the leaky gut dysbiosis of the intestine can lead to systemic inflammation and hepatic steatosis. Bacterial metabolites and short-chain fatty acids Butyrate from fiber fermentation is anti-inflammatory and promotes gut barrier integrity. But when this level is low, the gut becomes leaky. Reduced short-chain fatty acids means more inflammation, insulin resistance, and fatty liver progression. The microbiome composition and method. Increased Firmicutes bacteroides ratio means more energy extraction, means obesity and insulin resistance. Overgrowth of ethanol producing bacteria, that is E. coli species, Escherichia species, leads to endogenous ethanol damages hepatocytes. So the expert insight on this case history will be that the gut microbiome is a metabolic sensor. It's out of balance, your metabolism too. So if its balance is disrupted, your metabolism is also disrupted. Case history number 3, microbiome targeted therapies, what works? A 50-year-old male with muscle and type 2 diabetes is struggling with metabolic control. He is already on GLP-1 therapy but wants to explore gut-focused interventions. What options does he have? So, the emerging microbiome targeted therapies include probiotics and prebiotics. This is the first group. Lactobacillus and bifidobacterium strains improve gut barrier function and reduce liver inflammation. Did I suggest of this? Prebiotics, that is the fiber, inulin, resistant starch, fuel beneficial bacteria, increasing short-chain fatty acid production. The second group is postbiotics, metabolites of gut bacteria. Butyrate supplementation may reduce inflammation and improve insulin sensitivity. Urolithins from polyphenols support mitochondrial health and gut-liver crosstalk. The third group is that of fecal mitochondria transplantation. Early studies show potential for modulating metabolic disease but need further validation. The fourth is targeting the gut-liver axis with diet and lifestyle. Mediterranean diet, which is rich in the fiber, polyphenols, and healthy fats, positively alters microbiome. Time-restricted eating, the intermittent fasting, it modulates gut circadian rhythms and microbiome composition. And exercise, of course, enhances microbial diversity and gut barrier integrity. So the expert insight on this case will be microbiome modulation is an exciting frontier. In the future, we may see personalized gut-based treatments for metabolic disorders. So let's enter the phase Stump the Expert rapid fire microbiome cases. I'll ask a case history, I'll ask a question, and you will answer that. So the first case, a 42-year-old patient with muscle and metabolic syndrome asks if probiotics can reverse his fatty liver. What's your response? Probiotics alone won't reverse MAST, but they can complement diet and exercise by improving gut health and inflammation. Second case, a lean 35-year-old woman with persistent insulin resistance has increased gut permeability on stool testing. Could gut targeted therapy help? Yes. Leaky gut can drive insulin resistance even in non obese individuals. Addressing microbiome health may improve glucose control. Case number three, a 55-year-old with MASLD and recurrent bloating asks if intermittent fasting could help. What's your take? Absolutely. Time restricted eating reduces gut inflammation, resets microbiome balance, and improves metabolic flexibility. So, the take home messages from today's discussion is the gut liver axis is central to metabolic health. Dysbiosis contributes to muscle insulin resistance and inflammation. Microbiome targeted intervention, that is the probiotics, prebiotics, postbiotics, hold promise in metabolic disease. Lifestyle, diet, exercise, fasting remains the foundation for gut and metabolic health. Optimizing the gut may be the next big breakthrough in metabolic medicine. So, question for you today is, have you used microbiome focused therapies in your clinical practice? Share your experience in the comments. Let's continue the conversation. Coming up next, mitochondrial dysfunction, the overlooked factor in metabolic health. Subscribe and turn on notification to my channel. Let's change the way we approach metabolic medicine. Thank you very much. See you in the next episode on mitochondrial dysfunction, the overlooked factor in metabolic health. Till then, take care. Khudafis.